Health systems are fragile globally, but particularly in Africa. Despite majority of our disease burden being preventable, we continue to heavily invest in a fragmented way into more costly curative care. The FAH is a partnership working on strengthening community health systems that are critically important for improving health outcomes. They also provide job opportunities, particularly for women, youth, and members of marginalized groups. However, community health systems are underfunded and under-recognized despite a compelling economic, health, and social case to invest in them. That's why we are trying to fix it.
My experience was that the first, since 1970s up to 80s, much of the community health financing and support was majorly in the hands of donors and CSOs. So government did not pay much attention until 1986, when they just had to refocus on the 6 killer diseases. They were looking at immunization, but they didn't know how important it is beyond immunization and etc. So, but as the population started growing and people started getting more money, then the burden of disease also had to take another angle. So the good thing is that the development partners were able to gather evidence, to provide data that we used as government to defend the position that health financing for community health is important.
We work at the country level to support ministries of health, finance, and stakeholders to get a better understanding of what their resource needs are and what the system could cost.
In summary, we wanted to know the total cost of the program, and also we wanted to know the different components of the community health workers program that can be costed, which we knew will help us to mobilize resources or skewed mobilization of resources towards the donor interest, either as per intervention or by the country. And also important for us was the issue around advocacy and building an investment case. So when there is an outbreak, we are able to mobilize the community health, like the Ebola case, workers to go in, raise awareness, support communities, understand the effect of some of these things. And also important was about how do we also ensure that when the outbreak ends, what happens next after that? Because so many things will have changed. So many deaths, so many families traumatized, a lot of things. So this is where also a multi-sectoral approach comes in, wherein we bring all the different resources together, and then we see how we can galvanize all these efforts to support the different areas affecting the community. And I think that is the value of a community health program, because it's not just about health, but it brings different components together to ensure that interventions are implemented in community.
In terms of my involvement in community health, I was involved in the creation of a new financing mechanism for community health, which changed the way in which community health was financed, managed, and monitored.
One of the key questions that a Ministry of Finance usually has is, what is the return on investment? So what are the benefits of investing in a given health sector priority? And also another aspect is understanding what the budget baseline is. How much is the Ministry of Finance already putting towards community health? And in order to have a clear budget baseline, you need to be able to have strong public financial management systems to be able to track financing and expenditure for community health. And when a Ministry of Health goes to the Ministry of Finance, the Ministry of Health needs to have a clear understanding of what the ask is. What are you actually asking for? What are the funds going to be used for? And one thing to keep in mind is that ministries of finance might not have new money to put towards expansion of interventions or funding new interventions. And there are difficult decisions that ministries of finance need to make in terms of reprioritizing funding. And when there's no new money, there needs to be cuts to existing programs and shifting of funds to new priorities in government and specifically in the health sector. In terms of suggestions of what ministries of health could do to improve their chances of mobilizing domestic resources for community health is to reach out to their planning department colleagues. And in many countries, the planning departments work very closely with the ministries of finance so that planning and budgeting processes are aligned, and both departments work together to set government-wide priorities. And it's very important for ministries of health to work with their planning departments to ensure that health sector priorities, such as community health, are leveraged in government-wide priorities. One of the key questions that ministries of finance have is, what is the return on investment? So economic evaluations are critical for ministries of finance colleagues to make decisions around resource allocation.
We work at a country level to help ministries of health, finance, and stakeholders to get the best possible understanding of costs and the resources they need.
There has been a 2-day workshop on developing the Laikipia Health Strategy 2021-2025, and it has been under the flagship of Finance Alliance for Health in partnership, of course, with the county government of Laikipia. It has been so successful, and I would want to say that from the organization, the planning, the IC materials, and also the templates that had already been tailor-made to assist us to write down the situation analysis in Laikipia County. That was a job well done. It was very organized, and the facilitators and also the organizers of the event were very passionate, and they were able to take us through the whole program. And the stakeholders who were the partners to Laikipia County government and also the health staff who were present actually were able to understand community health strategy in a deeper way. They were able to identify the gaps and actually came up with achievable solutions. So I would want to say thank you so much for even identifying Laikipia County as a county to work with, because I believe this is just the inception, and I cannot wait, for the end results of this.
So, Laikipia UHC model is principally anchored in primary healthcare, which is significantly spearheaded by the community health volunteers. Some of the roles that the CHVs have played for us have been major and important. One of them being collection of data from over 99,000 households in Laikipia, which then enabled us to stratify our households from the most vulnerable to the least vulnerable, which aligned with the national UHC model, whereby they were willing to pay for 14,611 households. Number two, they also helped us to do a knowledge, attitude, and practices survey, which then informed the strategy that we used to get our NHIF uptake from less than 30% to the 64% that it currently is at. which is the highest in the country.
And we also plan to increase the numbers of community health volunteers to at least 1,500, so that at least each and every household is well and adequately covered, and also to take care of the areas in the hard-to-reach areas where we need to reduce now the number of household that community health volunteer is covering. Then, so our future plan is to have this program being sustained through the department and entrenched in a policy that will also protect the posterity of the program for the future CHVs to come, for future governments to come, and also for the future for the communities that we are serving. So we also want to equip our CHVs with means of transport. We want to make sure that the monthly allowance that we have been paying, that it will be sustained, and something that is going to go on.
We work at a global level to advocate and effect change for the health architecture that we are trying to change.
I think the question of innovative financing is always an interesting one. I guess an ex-accountant and a finance person, I always tend to disappoint people with the idea that actually finance isn't particularly innovative. And I think in innovative finance, there is this sense of it's the financial structure that is the really creative component of the transactions. I tend to think, while that can be true, while I think what's innovative in finance is the deployment of capital in spaces where it hasn't been deployed before in different ways. The actual mechanisms for finance are not really that complicated. What I tend to see is that in many of the conversations that involve innovative finance transactions, the real crux and the thing that takes the most time, and I think you see this in things like impact bonds, is the real discussion around those is actually getting people who don't normally work together, so the finance sector and the development sector, maybe, or the private sector and the development sector, to come to an alignment around the solution to the problem that they're trying to solve. And once you have the solution aligned and people aligned around how they can do that and why that has real value, the financial structure tends to be something that is actually relatively straightforward to develop. But really the investment of time is in bringing the different thinking of the different parties in the transaction together to look at solving the problem.
What the Finance Alliance for Health was looking to do was to basically create a mechanism that would allow governments to put more resources into community health, knowing that if you invest in community health today, you have tremendous savings in the future. And so on its face, you would think that governments would recognize that this is a valuable investment to make. The challenge is that many governments have, when it comes to their operating revenue, have very limited operating revenue. And when it comes to their capital budgets, they don't like the idea of putting borrowed funds, investment capital, if you will, into soft areas like community healthcare. They like to put that into a port or a road or a airport, something that sort of clearly will generate toll revenues or airport fees or something like that. So the idea was to create a low-cost financing mechanism that would encourage governments to invest in their community healthcare with the sense that first off, the financing would be low cost, so they wouldn't have to generate a lot of revenue to repay it. And secondly, if they achieve the performance outcomes that were sought, donors would in essence kick in to pay for that cost altogether. So in fact, in a perfect world, there would be in essence no financing costs. They would be able to fund the community health system and then reap the benefits of the better health for their populations by having that community health system out there.
We want a world where everyone has equal access to quality health care. We also want dignified job opportunities, in particular for women. Community health systems, when they are funded, are a prime opportunity for that because 70% of community health workers are women. We want female leadership in global health and development.
When I think about why I wanted to work at the FAH, I think that the FAH had this really unique blend of work on analytics and financing while also working on strengthening community health systems. And I am someone who really believes in the power of strong primary healthcare and community healthcare systems, but I also had an analytics background. So the blend of those two things really appealed to me. And when I got to the FAH, I would say by far my favorite thing about working as a contributor at the FAH was working with their team. The team at FAH is, I would call them small but mighty. They're a group of really smart, driven, and just high impact individuals who have deep knowledge about both community health systems and about financing in global health. And that blend really allows them to work on high impact projects.
While I was working with the Financing Alliance for Health on this project, I really learned a ton about all of the different areas that the Financing Alliance works in. And I was really helping to synthesize some of the content that the Financing Alliance has to develop written materials for the course, develop learner engagement questions and activities to really help learners understand these concepts.
We want Africa health systems work to be done by local leaders that understand the context.
I would say I got more than I bargained for. So throughout my time at Financing Alliance for Health, I worked on two very fulfilling pieces of work. The first was supporting the Division of Community Health in designing the community health strategy in Kenya. And the second piece of work was working on a project to estimate the community health funding gap in sub-Saharan Africa.
I would say what prompted me to engage with the organization were a few things. So first, I wanted to deepen my knowledge of the application of health financing instruments and mechanisms in primary healthcare settings on the African continent. That was, sort of what my background had been, what I was studying, and I wanted to put it into application. Two, I wanted to build expertise in actually, the development of such tools. So not just perhaps adopting something that's already there as a concept, but actually building them, trialing them within the system, and making sure that they can achieve the intended impact. And then three, I also wanted to gain exposure to sort of the workings of a health startup on the African continent, especially one that operates in such a niche area, such as community health, as well as sort of a high impact area. And suffice it to say, I was able to gain, exposure to all these things and more during my time with the incredible team at the FAH.
And that's why we try to model that at the FAH. Thank you.